What is the CEA tumor marker test for colon cancer metastasis? Imagine a simple blood test that can give doctors a heads up about whether colon cancer has come back or spread. That's what the carcinoembryonic antigen, or CEA, tumor marker test does. It measures the level of a protein called CEA in your blood. This protein can be higher in people with colorectal cancer, especially if the cancer has spread to other parts of the body like the liver. The test isn't used to screen the general population for colon cancer. Instead, it's a tool for people already diagnosed and treated for colon cancer. After surgery or treatment, doctors regularly check CEA levels to see if the cancer might be returning or spreading. Usually, they measure CEA before treatment to get a baseline. Then, during follow-up, they check it every 3 to 6 months for the first 2 years, then every 6 months for the next 3 years. Sometimes, they continue testing up to 5 years, especially for patients with stage 2 or stage 3 cancer. If the CEA level is high or keeps rising, it could mean the cancer has come back or spread, often to the liver, which is the most common site for colon cancer to metastasize. But it's important to remember that CEA isn't perfect. About 70% of recurrences are detected with CEA testing, and it has about 80% sensitivity. That means some cases might not show elevated CEA levels, even if the cancer has returned. Plus, other conditions like smoking, inflammation, or other types of cancer can also raise CEA levels, so the test isn't diagnostic on its own. Doctors use CEA testing alongside imaging scans, like CORT scans, and physical exams to get a clearer picture. The advantage is that CEA can often detect recurrence about 5 months earlier than imaging alone, giving time for earlier treatment. Patients with lower preoperative CEA levels, such as below 30 micrograms per liter, tend to have better chances of having resectable metastases and improved survival. However, a normal CEA doesn't always mean there's no spread, and an elevated CEA isn't a definitive sign of cancer. It's just one piece of the puzzle. Regular monitoring of CEA levels helps guide decisions about further testing or treatment, but it should always be interpreted by healthcare professionals within the context of the patient's overall health and other findings. In summary, the CEA tumor marker test is a helpful tool in managing colon cancer after treatment. It provides early clues about recurrence or metastasis, allowing doctors to act sooner. Still, it's not a standalone test and must be used as part of a comprehensive follow-up plan. Always talk with your healthcare team to understand what your CEA levels mean for your specific situation and to plan the best course of action.